Hello viewers, welcome to our channel. Today Dr. Raghuram is with us, gastroenterologist at Care Hospitals, High Tech City. Hello doctor.
Hello.
Doctor, what is viral hepatitis?
Viral hepatitis, if we have to explain in simple terms, it is a viral infection which causes swelling or inflammation of the liver. So, hepatitis is a Latin term which indicates that hepato means liver and itis is inflammation. So, inflammation of the liver which is caused by viruses is called as viral hepatitis.
Okay. Doctor, what are the types of viral hepatitis?
Broadly, there are two types of viral hepatitis. One is acute viral hepatitis and the other is chronic viral hepatitis.
Okay.
If the infection is there for less than 6 months period, we label it as acute viral hepatitis, and if the duration of illness and duration of infection is more than 6 months, then we label it as chronic viral hepatitis.
Doctor, what are the clinical features for viral hepatitis?
That would depend on the presentation. Like I said, in acute viral hepatitis, the symptoms have been there for a short period of time. Most of them, they tend to experience loss of appetite, vomiting can be there, and over a period of time they develop jaundice, which is yellowness of the eyes and dark yellow colored urine, passing dark yellow colored urine, and other manifestations like pain in the abdomen, passing white colored stool, or generalized itching all over the body. These things may also be there.
Okay.
When it comes to chronic viral hepatitis, usually there will be no symptoms. Most of them, they are detected when we do the blood investigations for some other reason. Say people usually, if they undergo a routine health checkup, they come to know that there is a virus that is infecting their liver. So, and the viruses are also specific. The acute viral hepatitis is commonly caused by 3 different kinds of viruses, which are called as hepatitis A, hepatitis E, and occasionally hepatitis B also causes acute viral hepatitis. Okay. There are other viruses as well, but they cause viral hepatitis in rare scenarios. When we speak about chronic viral hepatitis, the common viruses which cause chronic viral hepatitis are hepatitis B and hepatitis C. And in chronic viral hepatitis, usually there will be no symptoms, but over a period of time, say 10 to 15 years down the lane, if the process is goes on unabated and if we don't treat them properly, they may land up in cirrhosis. Cirrhosis is the liver becomes totally shrunken and it is fibrosed. So normally the liver is soft in nature. Normally the liver is soft in nature, but over the period of time when cirrhosis develops, it becomes hardened or fibrosed. And in cirrhosis also, some people may develop swelling of the legs, and there can be fluid accumulation in the abdomen called as ascites. In further stages, they may go on to develop coma, or the kidney may also be involved. We call it as hepatorenal syndrome. And in advanced stages of cirrhosis, blood vessels are engorged in the esophagus and stomach, leading to bleeding. So such people, they have either blood in the vomiting, or they pass black colored stool or frank maroon colored stool in. So these are the symptoms that are noticed when the cirrhosis is very advanced. We call it as decompensated cirrhosis.
Okay. Doctor, how to prevent viral hepatitis?
Now, the modes of transmission of these viruses is totally different. Hepatitis A and E, the mode of transmission is basically feco-oral, meaning that the virus which is there in the fecal matter of an infected person, when it contaminates any food sources or any water sources, and if that food or water is consumed by some other person, then this person may get infected because of the virus, and they may develop acute viral hepatitis. Whereas the modes of transmission for hepatitis B and C is totally different. They are acquired through infected syringes, if they have undergone any surgery and the instruments have not been properly sterilized. And at times people undergo this tattooing. So the needles used for tattooing, if they are not sterilized properly, through that also they may acquire this hepatitis B and C infection. Sexual route is one route of transmission for hepatitis B and C. and the transmission may also happen from the mother to child during the process of delivery. So these are some routes of transmission for hepatitis B and C. When we speak about prevention, there are vaccines available for hepatitis A and B, right? So now we recommend that each and every person should undergo vaccination for hepatitis B particularly. And hepatitis A vaccine is also recommended in people who have cirrhosis, so that they don't develop any new viral hepatitis or new episodes of jaundice because of the viral infection later on, right? We don't have any vaccines available for hepatitis E and C right now. And other modes of prevention would mean that we should avoid contaminated food or water. Properly boiled food and properly cooked food is always safe to consume. And water also, it's better to rely on a proper source of water, which either a boiled one or properly filtered water. Using an RO will also be helpful. So if are cautious regarding the sources of food and water, and we avoid contamination of these things, we can avoid acute viral hepatitis most of the times. To avoid chronic hepatitis, vaccination for hepatitis B is one modality, and avoiding tattooing and all is helpful, right? And all the pregnant mothers, they undergo evaluation for hepatitis B and C during the antenatal checkups, when they go to their obstetrician or gynecologist for routine antenatal checkups. These blood tests are done to see if they have any hepatitis B or C infections.
Okay.
And if there is evidence of infection, they can be treated accordingly. So these would constitute some of the preventive measures to avoid viral hepatitis.
Doctor, what are the treatments available for this problem?
For acute viral hepatitis, there is no specific treatment available. The treatment is most often supportive. So we encourage people to take a proper nutrition so that the liver gets a chance to recover properly and in a short period of time. So nutrition is most important in acute viral hepatitis. Medication wise, the patient needs to take medications as advised by the general physician or a gastroenterologist. And rarely, if the situation worsens any further, then some people may develop acute liver failure. And for them, depending on the severity of the problem, some people may be requiring liver transplantation as well. For chronic viral hepatitis, we have good medicines available for hepatitis B and C. Right now, there is no cure for hepatitis B, chronic hepatitis B. So with medications, we can control the inflammation in the liver. For hepatitis C, we have good medicines available now, which offer a cure in very high percentage of people, to the tune of almost 90 to 95%.
Okay.
So any kind of treatment has to be in conjunction with the treating doctor or a gastroenterologist.
Okay. Doctor, is there any risk factors after treatment?
Chronic hepatitis C is curable in most cases with available treatments right now. Hepatitis B is a lifelong condition. With medication, we are only controlling the inflammation, but the infection will still be there, right? And hepatitis A and E, once the acute infection resolves, there is no long-term problems to the liver because of the infection.
Okay. Thank you so much, doctor. Thanks for the information.
Thank you. Thank you.
I hope you like this video. If you like it, please like, share and subscribe to our channel. Thanks for watching. Thank you.